Did you know that there are CPT codes for skin tattooing, and maybe they're not used for what you think they're used for? So let me explain not only what we use these codes for, but how we apply them. Hey everyone, I'm Victoria. I'm a medical coder, auditor, educator, content creator, and on my channel, I provide tips, tricks, and tutorials to help you be successful in a medical coding career. I saw a question come up recently on a Facebook group about skin tattooing, and I thought that would be a great one to cover because it's not something that commonly gets used unless you're in certain specialties. There's 3 different codes we have for skin tattooing: 11920, 11921, and 11922, and they are based on square centimeters. Now, the first thing that you have to understand about these codes is that if we're going to bill them out to insurance, we have to have medical necessity, which means this isn't a code for you going out and getting mom tattooed on your arm. This is a code because you have some sort of medical condition that requires skin tattooing. Some of the reasons that a patient might need to medically get a tattoo is if maybe their finger was involved in a crushing injury and their nail bed was damaged and their nail won't grow back. They might medically just need a fingernail tattooed back on. Or sometimes patients will have burns or various skin conditions where the pigment on their skin is all kinds of disarrayed and in different colors, and they may medically just need something tattooed back on pigmentation wise. Now, this isn't for like getting your eyeliner tattooed on, although that might be done in a medical office because it's a sensitive area, but that's not something you would bill out to your insurance company. One of the most common medical reasons for having tattooing done is for post-mastectomy patients who've had breast reconstruction and need nipples tattooed back on their breasts. There's all different kinds of breast reconstructions that are done for breast cancer patients. Some do save the nipples, others they're reconstructing them, and there's a lot of different ways that they reconstruct the breasts. Sometimes they place tissue expanders underneath the skin to stretch the skin out, and then they put in a permanent implant. Other times they'll rotate tissue from other areas. They'll recruit it maybe from the back and rotate it in, or from the abdomen and rotate it in. Other times they will completely dissect it. They will do microvascular surgery where they dissect all the attachments to the skin from the abdomen, which people like because it gives you like this tummy tuck plus a new set of breasts after your mastectomy, but that has to be done by a trained microvascular plastic surgeon. And one thing to clarify is that if you are having nipple tattoos, there is a code for nipple reconstruction, 19350, which you bill for each nipple that you're doing. So if you're doing it bilaterally, you would need a 50 or an RTLT depending on the payer preference. That includes the tattooing. So if you are doing that tattooing within the 90-day global period, that is included in the nipple reconstruction, which is when they do things like skate flaps and just kind of make that nipple shape on the breast. Now remember, when we're billing for these services, we're billing them under that provider. So that doctor or nurse or whoever is a billable provider has to be the one performing that service. It can't be that you have someone come into your office from a tattoo shop and have them do that service and then bill it out to Medicare or someone under that physician when they didn't actually render the service. A lot of times patients will go to places like tattoo shops and pay out of pocket to have this done because tattoo artists do better jobs of them. They can do really realistic 3D tattooing of the nipples that they look absolutely like nothing has ever been done to this patient, that they are real nipples. Our first code is 11920, which is for up to 6 square centimeters, which would be about that size of a nipple. And then our next one is for 11921, which is for up to 20 square centimeters, which would be much larger. So what happens is you don't, let's say it's a 6 square centimeter on each side, you would total them up and code it to a total of 12 square centimeters. You don't code 11920 for one and 11920 for the second one. And because these are codes that are not anatomic specific, they could be for your shoulder, your head, your back, your groin, your legs, your toes. They just go by square centimeters. So these aren't ones where you would put anatomical modifiers like RT, LT, and 50. It just goes by the total square centimeters of whatever areas were totaled for that tattoo for the day. 11922 is an add-on code, so it can only get added on to 11921, and that's for patients that have more than 20 square centimeters tattooed total, and that 11922 2 is for each additional 20 square centimeters or part thereof. So even if it's 20.5, you can still use that add-on code because that 0.5 is a part thereof of that additional 20. So for example, if we had 2 of these that were 6 square centimeters on each side, that would total 12 square centimeters, and we would use the 11921. If they were more than 20, that we had maybe 25 square centimeters that we were tattooing total, we would use 11921 and then an add-on for that additional portion for 11922. So it's really important that when providers are doing any kind of tattooing in the office, be it because they need to change pigmentation because of a skin discoloration or tattoo a fingernail or something on, and it truly is not cosmetic, it really is a medically appropriate to retain a normal anatomical appearance, that you need to be very careful about how you're documenting what is the medical necessity of that it's not just cosmetic, so that your insurance company will understand that this is something that they need to pay for, and that if you need to appeal, that you have supporting documentation for that medical necessity, and that the provider documented the correct square centimeters and anatomical locations. I hope that helped you understand a little bit more about skin tattooing codes. If it did, or if you just found this interesting, make sure you give me a big thumbs up. And don't forget to subscribe, and you're going to want to hit that notification bell to support this channel and make sure you get alerts when I post new videos. I will see you in the next video, and until then, just keep on coding on.